Hey everyone, Dr. Casey Schneider here, and welcome to Movement Everyday, episode 6. Today we're going to do a continuation on what we spoke about in our last video, which was post-isometric relaxation, or PIR. Last video we did hip flexor strength and testing and showed you what PIR is with those muscle groups. And now we're going to show the upper neck area. Specifically, we're going to test and try to fix upper trapezius tightness as well as levator scapulae tightness. Okay, let me show you what these muscles do. All right. So the trapezius is actually a fairly big muscle, and it's consistent of 3 areas: the upper trapezius, the middle trapezius, and then the lower trapezius. But today we're going to talk mostly about the upper trapezius. Okay. The action of the upper trapezius is head extension on both sides, both bilateral contraction. But if one side contracts, it's extension and contralateral rotation, or the nose goes away. Okay. Now, to test the muscle strength of this muscle, it's actually very simple. You have the patient go in the extension and contralateral rotation, and then you have them elevate the shoulder just a little bit, and then you tell them to hold this position. Now, Brandy, can you hold this position? And that's the muscle test for the upper trapezius. Okay, you can relax. The muscle test and action of the levator scapulae is very similar. Bilaterally, it contracts and it causes head extension. But instead of causing contralateral rotation, or the nose goes away, the levator scapulae causes extension and ipsilateral rotation, or the nose goes to the same side. Okay. To test the strength of that muscle, you also do the same position, and you elevate the shoulder, and you tell the patient to hold that position while you try to stretch the patient in the opposite direction. So can you hold that position? And you can see Brandon's pretty strong. Okay, you can relax. Now, what I'm going to show you is now PIR, or post-isometric relaxation, for both these muscles, okay? Just real quick, I forgot to mention, with the levator scap and the upper trap connects here up in the upper tissues of the neck onto the space of the skull, and it scoots down here, and it inserts onto the clavicle and the spine of the scapula. Okay, the levator scapulae inserts onto the upper cervical transverse processes, the vertebrae, and then it goes all the way down and inserts right on the top of the superior angle of the scapula. And the actions of those were what I've showed you, but also I forgot to mention is those muscles also elevate the shoulder, and that's why we're having them elevate the shoulder when we stretch to assess the strength. Okay. All right, now we'll go right into PIR. So PIR, or post-isometric relaxation, for the upper trapezius is like such. You're just going to put it in a stretch position. So the upper trapezius opposite action would be flexion of the neck, and it would be ipsilateral rotation. Also, we're going to have them elevate the shoulder just a little bit, and then kind of hold the patient here and tell them to give you about 10 to 20% contraction and do the opposite direction, okay? So he's going to have his head try to extend backwards and rotate to the other side, and he's going to hold this for 10 seconds. Then he's going to take a deep breath in, all the way out, and we're going to stretch the head a little bit more until we get to that barrier of resistance. Then we're going to have him go right into doing it again, push up with the shoulder, turn the head back and rotate to the other side. Good. Okay. Give me about a little bit more. Good. 10 seconds. Take a deep breath in, all the way out, and relax, and you bring it to a new barrier of resistance. You do that 3 times, okay? And you stretch the muscle. Next one we're going to do is we're going to do the levator scapulae muscle, okay? Same exact concept, but instead of turning the nose towards, we're going to turn the nose away, okay? So extension of the neck. That's this is the motion of the muscle. Now to stretch it, we're going to flex and turn the head away. And now I'm going to tell him to hold this position. I'm going to tell him to elevate his shoulder just a little bit and lift his head back and rotate to the other side. Perfect. Hold 10 to 20 seconds. Take a deep breath in, all the way, and relax. And now you're going to stretch the neck down to the new barrier of resistance. Again, you're going to do that 2 to 3 times, okay? 3 times, okay, with each muscle. The point of this is to make sure that these muscles become stretched, because these are very common muscles that cause irritation, pain, and dysfunction within the body. I'm going to talk about something hopefully in the future videos called upper cross syndrome, Upper cross syndrome is when you have rounded over shoulders and your head is protruded forward, and this is usually due to a sedentary lifestyle, or you sit down a lot, or you're always looking down at your cell phone. And these muscles, especially the upper trapezius and the levator scapula, those muscles become very tight with that kind of syndrome. So this technique would be a great way and to start doing to stretch those muscles and get us back to normal posture. I hope this helps everybody, and until next time, remember, movement is everything and movement is life.